Hi friends, this is another topic. What I am dealing with is called as anti-epilepsy, and this is also one of the important topics, particularly related to CNS system, nothing but the central nervous system. And today we'll just see the introduction part, how and what happens when the epilepsy is out. So we know that the epilepsy is one of the CNS disorders, and also it is related to various neurotransmitter neurons which is submitting their neurotransmissions. Particularly this epilepsy is related to two neurotransmitter neurons, particularly called as glutamate and also the GABA. We know up to all these classes, we know that the glutamate is an excitatory neuron and GABA is an inhibitory neuron. And here this epilepsy is always followed by both of them. That is, it is called as electrification of the neurons. Why? Because it is also called as lightening of the neurons. Why? Because the thunder-like, shock-like, electrical jerk-like neurons discharges will be happening into the brain part. So this is called as epilepsy, and this is also commonly called as seizures, which is called, the seizures is a word called as episodic, nothing but a small gap, once again it starts, once again a small gap, once again it appears. So it is called as episodic. So it is called as seizures also. And here I have given you the word seizures, and the seizures is given by the word called as episodic. And if at all there is any behavioral changes after getting into this epilepsy, then that word can be called with convulsions. So whenever the epilepsy is being discussed, we always discuss with two words. One is seizures and other one is convulsions. Seizures, as I said before, it is episodic, and convulsions, it is called as the behavioral changes. So both of them will be combined and it is called as epilepsy. And these in commonly it is called as fits. And particularly this epilepsy is characterized by aura. Aura is nothing but sound, but now that it is also can be called as cry. That means the sound which is being eradicated out or elicited out whenever we have this type of epilepsies. So the epilepsy can be defined as a small definition here. It is a paroxysmal neuronal discharge of the brain, which may be episodic, synchronal of increase of potassium and calcium and decrease of chlorine. So the two words here, increase of sodium and calcium, is giving you by the word electrification. That means the polarization, the action potential will be more and more, and the discharge of the neuron happens without any passage of messages from one neuron to the other neuron. So there is no corresponding neuron in between to take up the message. So the message what has been transformed, it is discharged out of the neurons without any crossage of the messages. And here the chlorine is also being inhibited more and more. Sometimes what happens, there is inhibition of chlorine in higher amount, or there may be sometimes there is increase of chlorine inhibition. So both of them can be happen. That means there is no balance between the excitation and the inhibition. Once the excitation is more, and also that excitation is not able to balance with your inhibition, so what happens, the electrification and the electrical shock or the lightening of the neurons will happen. And sometimes what happens, the discharge of chlorine is more and more. That means the inhibition is more, and whenever there is inhibition is more, it is not able to balance with the excitation of the sodium and calcium ions, which are related to the action potential of your action potential. So what happens, there is no balance between the chlorine and sodium and potassium. So what happens, particularly you have your neuronal discharge from the neurons and the message has not been transferred. And now we'll see what is the type of seizures, and according to the seize, what is the seizures, the convulsions, the episodics here, and I also given as a word called as paroxysmal. This paroxysmal is nothing but outburst without any signal. That means the epilepsy cannot be given without a signal also. Sometimes it may come with a signal, or sometimes it may cannot come with a signal. So it is called as paroxysmal. That means the seizures and the convulsions cannot be predicted by a particular person. And in order to see what type of seizures will be come across, so that we can identify what type of convulsions is having there. And so this is been divided into different types. Particularly it is divided into two main categories. One is called as generalized. Here I gave you word generalized. And it is also divided into the second category, what is called partial. And here by the word indicating that it is generalized. Generalized means it is common for everything. And here the partial, the word is indicating that it is just to that particular focal region, for a particular local region. So this is also called as focal seizures or local seizures. And here the generalized is done by common all over the brain. So we can call all over. All over. So by these two words I am depicting you with a small diagram of here. This is called the brain, which has been divided into 4 lobes, we know that, and it consists of 4 lobes, the temporal lobe, the primary lobe. So different types of lobes, we know that. So if at all the seizures starts at one point, so I am indicating here with a small point over here, and this particular point is one point where the discharge is happening with the neurons. So the neuron which is submitted at particular point or particular focal area or particular region at that spot, which is been categorized only with sodium and potassium, and the only discharge is only focused at that particular and also at that particular lobe. So it may be first lobe, or it may be second lobe, or it is a third lobe, or any fourth lobe. So whenever the seizure is been confined to only one lobe, then we can understand that it is a partial seizure, and this partial seizure can be divided into 2 types. Here I am indicated over here. One is called as simplex and the other one is called complex. So what is simplex? Simplex means the patient who has been accompanied with the simplex may have their seizures 1.5 minute to 1 minute, and sometimes it may more than 1 minute, but usually it is about half to 1 minute. And it sometimes, as I have indicated here, the body may have or may not have the consciousness of the body. So that means the person who is confronting with the simplex form may go into the conscious stage or may not go with the conscious stage. And also he may get any type of simplex partial conscious where the consciousness cannot be seen, and sometimes the person may be get it conscious. And here the other word is called as complex. The complex seizures are nothing but the seizures which are a little bit more complicated, and it is extended more than 1 minute. And here you can see particularly the person goes to consciousness, and also sometimes there may be impairment of the consciousness, and sometimes the body may go for jerkings. That means the body may go for convulsions. That means the body may go for seizures. And only sometimes what happens, it may only confine to the convulsions. That means the behavioral changes. And sometimes it may only confine to the seizures, nothing but the episodic of neuronal discharge. So the complex is a both of simplex and also both of convulsions and also the seizures, and it may extend more than 1 minute. So that is called, if it is simplex we can call partial simplex, and if it is complex we can call partial complex. So this type of seizures can be categorized under partial seizures. And now we'll come to the generalized seizures. As the name indicating itself, it is, as said before, it is been focused for all of the lobes. That means it may not be only confined to the first lobe, but it also be confined to the second lobe, and it also been spread to the first lobe, and also it may be confined to the third lobe. So the focus point may be started over here, but it is been extended to the first lobe, it is extended to the second lobe, and it is extended to the first lobe. So what it is indicating, that it is indicating you that it is being started at one point, that means with a partial seizures, and being spreaded all over the body, or sorry, all over the brain, along with all these type of seizures. One point we need to remember, that whenever it is a focal point over there, we need to remember that only the sodium has been discharged over there. But if at all it is crossing over, it has to spread it first of all to the cortex area, which is confined the top of your brain, and where the calcium is being spreaded and dropped down, so that all the lobes are being affected with the electrical discharge, nothing but the lightning discharge. So this is called as generalized. Usually this generalized is always accompanied with unconsciousness. So maybe it is also unconsciousness, but also it is called as impairment of consciousness. That means the disability of consciousness, which may be disturbed, uncontrolled. So this is divided into different types, and just it is a small definition types we can finish off. So what is tonic? Tonic generalized seizures. So what happens whenever there is a tonic type, which is always extending from 1 to 2 minutes, where the spasm of the body muscles will take place. That means the blocking of the body muscles will take place, so that the activity may not be done, and he has to stand that position. And that clonic, sometimes what happens, the seizures, what is been happening in the convulsions, what is happening, it is always indicated by the body jerking. That means front and forward, forward and front and forward, and sometimes we may have to bend ourselves like this, jerking part. So we can't tell you what are the symptoms particularly. So whenever there is a jerking of the body, it is said to be as clonic generalized seizures. And sometimes what happens, it accompanies both of them, that is tonic and clonic. So that type is called as generalized tonic and clonic, which is always accompanied with a spasm of body muscles, and also it is accompanied by the jerking of your body. So both are accompanied one by one. So first it starts with tonic and go for clonic, and again it starts with tonic and again go for clonic. So the spasm continues from 1 to 2 minutes, and it is also characterized by the aura. That is, the person may get unconsciousness and he may not be respond to the local area, right? And next you have another one called as myoclonic, and this myoclonic is some of the related to, here the word is given by myo. So what it is relating? It is relating something to the muscles itself. So what happens whenever the myoclonic is being focused out? So you can say that how we can symptomize that myoclonic. It is shown by shock, nothing but the low volume of your blood, nothing but the low blood pressure, and also the movements, that means the momentary contractions, that means the particular contractions of the limbs or the body will be having for one moment and cancel for the second moment. It will come for the next moment and cancel for the third moment. So what happens, there is a momentary of contractions which is being done for the limbs and also for the whole body. And sometimes this myoclonic is also called as petit mal myoclonic generalized seizures. So this is called, always we can see that it is always extended for half a minute along with aura. And next we'll go for the atonic. Atonic is nothing but, as I said before, it is always more of excitations or more of inhibitions. So what happens, this atonic seizures, which is a generalized seizure, will always accompanied by the GABA receptors, where the inhibition is more and more, cannot be able to balance with the excitation, and that stage is called as atonic. So I have written here impairment of chlorine ions, nothing but the GABA receptors. And now anything left? Yes. One more is the absence seizures. These absence seizures are also called as grand mal seizures, where we can see some type of symptoms which is being done already with all the type. maybe tonic-clonic, maybe some symptoms of it, maybe some symptoms of which is accompanied by the tonic, maybe some symptoms are accompanied by the myoclonic, or maybe some symptoms which are accompanied by the atonic. So that is called as absence, and it is always indicating the word that it is absence. What is absence? Absence of something, absence of maybe the glutamate receptors which are excitatory, or maybe the inhibitory of GABA receptors. So these are the different small words which are related to the convulsions and seizures. And this is a general classification of seizures which is indicating you so what type of seizures can be seen all over. And now I'll do the erasure of this board so that we'll see what are the different causes for the epilepsy. So we'll end up with a small topic called causes of epilepsy. Actually, this epilepsy is not confined to only one reason. There are different types of reasons. One may be more, one may be less, like that. So, or otherwise, the symptoms of epilepsy may be accompanied with more and more causes, more and more, disorders, more and more diseases. And particularly, we can see the one is called as trauma. Trauma of brain. Next, sometimes it may be accompanied by the encephalitis. Encephalitis. Nothing but a disease of encephalon. Third one, it may come because of hyperglycemia. Nothing but more and more of glucose, where the glucose is in higher quantity. Next, you have hyponatremia. Nothing but the lesser of sodium ions. Natremia means lesser. Next, hypokalemia. Nothing but lesser of potassium ions. Next, we'll go for hypercalcemia. Nothing but calcium. And next, you have higher drug usage. Particularly the diuretics who are using potassium sparing diuretics, where hypercalcemia has been focused out. Next, we'll go for trauma, tumors of brain. Any accidents. So these are the different various reasons how the epilepsy may be covered. Particularly sometimes what happens, this epilepsy will be seen in children and who are been not so well nourished itself, but they have some mental retardations, mental disability. So that type of children can also be focused with epilepsy. So the children who are getting, particularly they are called as petit mal epilepsy. The children may get this type of epilepsy. So the children and who are being focused and when going to school, that per children has to be warned by the parents to the teachers that he is having so particular seizures, and we need to care about that. And in any situation, at any cost, the children may go collapses with epilepsy, that he has to be taken a small care, and that small care has to be given by the parents to the teachers. So the children is also being focused with the type of epilepsy. And tomorrow we'll see next in the next class we'll see what happens with the mechanism of action of epilepsy.